That's the reason why you came. That's the reason why you're here. That's what it took all the way through this crisis and beyond for us to get back to a sense of balance all over the world. It took courage. It takes continued courage. Courage is not the absence of fear. We all have fear. It's our ability to overcome it. That's what courage is. So as introduced, I'm Dr. Peter McCullough. I'm in practice as an internist and cardiologist in Dallas, Texas. I'm trained as an epidemiologist. I've been very involved in the pandemic response from the very beginning, doing the best I can with my research and my scholarship and my clinical care to help each and every person through this difficult time. Now let's see if we can get my slides up. I'm a little bit ambivalent about whether or not I should use slides or not, but if we can get them up, I'll show them perfect. I want to start out with a question. How many of you would say that you're very concerned about what you've seen with the COVID-19 vaccines? How many of you would say that at least one time or another you've been uncomfortable discussing the vaccines with somebody else? Okay, that qualifies as a hot button issue, and we are going to tackle it. Now, you saw the trailer for Courage to Face COVID-19. This is a book about the early phase of the pandemic, and it's not a boring medical book. It's a gripping true crime narrative. John Leake, who's a best-selling author, is a principal author, and his distillation of what's gone on, in effect, has been a global crime. Many of you resonated with that. And the crime, or the crimes committed, if there have been committed, have been fraud. That is, we've been deceived. We haven't been told the truth from our government agencies. And the result is, by the denial of full and effective and available early treatment, and by the relentless pursuit of mass vaccination, there has been mass negligent homicide. Now, those are strong terms. But indeed, court cases are going on all over the world with those charges being examined. These are very, very serious times that we're in. The uniformity of concern regarding these vaccines, which are in the market in every country in the world. Not a single country has removed them from the public market. Not a single country has opened a vial and examined independently what's in the vaccines, despite many calls for inspection. All of these observations should be enormously concerning to us. Let me have the next slide, and we'll check the advancers here. I'll just say next slide. If you could just do arrow forward, which would be great. This will be a brief outline. I think I just have a total of 14 slides with the outline. Next slide. Vaccine ideology. How did this happen? Vaccines are unlike drugs. They're unlike forms of physical therapy. They're unlike surgeries. Vaccines, I've concluded, are a form of a religious ideology in medicine. I never knew this before, but it's the only explanation of why doctors and nurses and others would behave the way they did through the pandemic. What do I mean by that? Next slide. Vaccine ideology says that humans are inherently susceptible to disease threats, infectious diseases. Through medical innovation, vaccines can make the human body more resilient through immunization. Because vaccines are not perfect, for them to work on a population basis, everyone must take them. Everyone. And if there's harm caused, or even if one loses their life, they have to take it for the team. That's vaccine ideology. And doctors really believe this. I recently presented a poster at the American Society of Microbiology. So I was deep in the academic pit of infectious disease in Atlanta, Georgia. And we had our poster up, and people were coming by. And a doctor came by. And he looked at the data, and it was about vaccine safety, and he winced. He said, yes. He goes, I've had 5 shots. I got to the point where my arm, I couldn't use it. I needed therapy. And then he looked me right in the eye, deadpan. And he said, but if they have a booster next fall, I'm taking it. He was saying to me very clearly, he's in the ideology. He's going to take it for the team. That's how strong this belief system is. Going back from Mary Worthley Montague, she was actually before Jenner on the early smallpox vaccine, all the way to the COVID-19 vaccines. Next slide. Vaccination has a history in medicine that is not scintillating by any means. In the 19th century, for decades, there was an attempt to mass vaccinate the population for smallpox. The vaccines were derived from the lymph of horses and cows. Sometimes the vaccines were done from human arm to human arm. This progressed at such a furious pace, an incredible hubris, that mankind was going to improve upon God's creation through the vaccination against smallpox, that it became mandatory. It became more than mandatory. Parents got put in jail if their kids did not take the smallpox vaccine. There were uprisings in Toronto, well-publicized uprisings in the UK. It led to the anti-vaccination league in the UK. You can see here, this is a depiction of what occurred in Toronto. And then ultimately, after the work of Alfred Wallace, who is given co-credit for his work on natural selection with Darwin, look at the title of his paper. Vaccination proved useless and dangerous from 45 years of registration statistics. Yes, he was right. The primordial versions of the smallpox vaccine were grossly unsafe. They could not have been pure. It's impossible. They were contaminated with staph and strep and tetanus and syphilis. And people died from the smallpox vaccine given to them against their will. That's the 19th century. How could we possibly be surprised with what happened with the COVID-19 vaccine? It's already here. Like Dr. Drew said, history is right in front of us. John Leake, my co-author, says is that history doesn't repeat itself, but it really rhymes. I mean, this really has a cadence. Next slide. What happened after his work, by the way, in the UK, is that ultimately there was a law that said, listen, this is elective. We can't force this on you. And quickly, about 25% of the population stopped vaccinating. What happened during COVID to create such a focus on the vaccine? That's what Tucker Carlson was asking me. Did any medical school in Canada, or Health Canada, or the Royal College of Physicians, or the Provincial Colleges of Physicians, did they ever hold a seminar to educate you on what you should do as a citizen to treat yourself early and reduce your risks of serious COVID-19? Did they give you any information on how to prevent the illness? Nothing. To this day, they don't. I can tell you medical schools do not have grand rounds on this topic. They don't review multi-drug treatment protocols for COVID-19. It doesn't even come up. My son graduated from medical school now over a year ago. I went to the ceremony. His class, was at the beginning, middle, and end of the COVID lockdowns, and it influenced his medical training greatly. We listened to the president, the provost, the guest speaker, the class president. All these speeches. Not a single mention of COVID or the vaccines. None. It's as if the pandemic didn't happen. I guarantee if you go into a Canadian hospital right now and someone presents with a giant blood clot in their leg, there will be no questions on whether or not they've ever had COVID or taken a vaccine. Yet it's a very relevant question. Next slide. This was a gamble. This was the gamble of all time. And I put it in writing in August of 2020. It's still on their website. Why was the vaccine program a gamble? One, it was allocating almost all of our resources towards vaccination. Do you know Canada did not do one large randomized trial of multi-drug treatment to save Canadians in nursing homes or elderly people? Not one. The U.S. government had one multi-drug treatment protocol. They stopped it after 20 patients, and they immediately just turned their attention to the vaccine. They didn't execute on anything. We had promising drug after promising drug, whether they were inexpensive generics, whether they were high-tech monoclonal antibodies. When used in combination, we gave patients a tremendous opportunity to survive this illness. But it was all about treating early. Instead, all the resources in public health messaging went into the vaccine. As Dr. Bhattacharya said, it was pre-planned by design. One of the things that's come out on Capitol Hill, and Anthony Fauci testified in Congress back in January, 2 days just ahead of my testimony there, one of the sidebar conversations we had is what came out is that the whole purpose of creating SARS-CoV-2 or creating any of these pathogens in biolabs is to create vaccines. Not therapeutics, to create vaccines. CEPI, the Coalition for Epidemic Preparedness and Innovation, that vaccine incubator formed by the Gates Foundation and the World Economic Forum, that's the one that John Leake is showing me the business plan. The business plan does say there will be a series of pandemics and there will be one answer, a very lucrative answer that everybody has to take, and that's a vaccine. If you're developing a treatment, you have to focus on a narrow, high-risk group of patients. But if one is producing a vaccine, everyone has to take it. The market is enormous. You can imagine from a business perspective, the degree of enthusiasm from the biotech sector for vaccination. It was a gamble, and a gamble for all time, because what was proposed is to take the dangerous and lethal part of the virus called the spike protein and then give it to the human body, but the format in which it was given was actually by genetic code, messenger RNA or adenoviral DNA, principally in the United States, with no ability to shut off the genetic code. So we could not tell in each person when it's injected, will this just go for a day or two and just expose them to the spike protein? Or would it go on for months or years? And to this day, we don't know. We don't know what happens when the genetic code for a lethal protein is inserted into the human body in the format of messenger RNA or adenoviral DNA. Next slide. This is the virus. The nucleocapsid is the ball. The spike protein is on the surface. That's the lethal part of the virus. That's the part that was engineered in the Wuhan Institute of Virology by design to be invasive and to be lethal to human beings. Now, everybody in Canada is a closet virologist. Everybody knows what the spike protein is. Everybody has had a biology lesson. The spike protein actually travels in trimers. It actually trimerizes, and it is the kind of key into a lock that allows the virus to inject itself in the body. Now, when it gets into the human body, the S2 segment, which is near the circle, the ball, that's sacrificed at the ACE2 receptor. So there is some receptor-mediated clearance of the natural infection, but the S1 gets into the body in severe infections. With the vaccine, the genetic code is inserted, and the full-length spike protein is produced. In fact, Pfizer and Moderna have used the same motif, what's called a proline insertion, to hold the spike protein open so the full-length spike is experienced in the body, and it's been found circulating in the bloodstream by Brogna and colleagues for 6 months or greater. No wonder some people feel sick for months after the vaccine. A foreign protein devised in a Chinese biosecurity lab is in their bloodstream. And there is no acknowledgement from the medical community this is going on, despite peer-reviewed publications and direct observation by independent scientists. Next slide. The co-conspirators in the creation of SARS-CoV-2, as memorialized in written documents, peer-reviewed papers, are Dr. Anthony Fauci, Ralph Baric at the University of North Carolina, Chapel Hill, Peter Daszak, and Dr. Xingling Li in China. The two papers at the top in Nature Medicine and Proceedings of the National Academy of Sciences declare in 2015 and 2016 that they have created a SARS-like Wuhan Institute of Virology 1 virus poised for human emergence. These papers will not be reviewed on Capitol Hill. Despite all of the choreography and all of the testimony, no one will directly read these papers into the record on Capitol Hill, which say it's gain-of-function research, started before the moratorium on federal funding and continued, that say that Ralph Baric and his team at UNC are the designers, Peter Daszak is the shuttler, he shuttles the plans to China, and Dr. Xingling Li and her team in Wuhan, China do the work. They thank the Chinese. And then from there, these papers are ignored. Yet they're published in some of the best basic science journals. This is prototypical, probably primordial SARS-CoV-2. It may have been upgraded. There was a protocol to upgrade it called the diffuse protocol. All this has come out in the Select Coronavirus Pandemic Committee. But yet, we still do not have formal investigations with special prosecutors to get to this. But I can tell you, my interpretation is a U.S.-Chinese collaboration created this virus intentionally, and at the same time, in these papers, by the way, they were testing early vaccines and monoclonal antibodies. It was by design to create a biological threat and to create countermeasures and for some entity to hold them, probably the EcoHealth Alliance. On their website, that's their aspiration, to hold biological threats and countermeasures as power tools. We no longer hear about, missile defense systems and missiles or what have you. This now in the world of biolabs. Next slide. What's happened with the pandemic? Well, the virus made many people sick. Sadly, those who did not get early treatment became hospitalized and died, almost 2:1. There's an analysis by Vertkirk and colleagues that shows that virtually everybody hospitalized received inadequate early multi-drug treatment. It evolved over time. But 2:1, it's because they weren't treated early. Secondly, virtually every death in westernized societies occurred in the hospital. It was unique that people weren't dying at home. So something occurred in the hospital. Next slide. That led to death. What we know with the vaccines is they are the second wave of the biological catastrophe. Here is messenger RNA going into the human body, producing spike protein for an uncontrolled duration and an uncontrolled quantity over time. The worst biological idea in human history. And you're looking at one of the few public figures who could see this ahead of time. There wasn't a single chief of medicine who expressed a concern about this worldwide. To this day, there's not a single chief of medicine who expresses a concern about this. Next slide. What we know now, React19 is a wonderful website to follow. There's 3,500 plus peer-reviewed papers on vaccines, injuries, disabilities, and deaths. The published studies, whether it's this one from Canada, the United States, or the one on the right from Japan, show the majority of deaths, when clinicians think the vaccine is related, in fact, the vaccine has caused the death. Vaccines causing death. That's the reason why all of you raised your hand. It is a terrifying thought that one could take a vaccine and then lose their life. Now, Anthony Fauci was just on Capitol Hill saying the vaccines saved millions of lives. We don't have a single prospective, double-blind, randomized, placebo-controlled trial showing the vaccines reduce mortality. In fact, in the randomized trials, mortality is higher with the vaccine. Now, Dr. Drew and I just observed fairly that once the vaccines came in both of our practices, we didn't lose a single patient. Now, was that the vaccine or was that patients getting early treatment? Well, early treatment in the published studies, the best we have them, multiple drugs used in combination, about an 85% reduction in mortality consistently. And don't forget, we didn't rely on one thing. It wasn't just monoclonal antibodies. We used oral antivirals, nutraceuticals and supplements, corticosteroids, anticoagulants, oxygen at home. Altogether, the package was impressive. That's what saved lives. So early treatment for sure. Natural immunity. Dr. Bhattacharya pointed out, through 2020, some groups, including young people in college, 60% of people had COVID through 2020 before the vaccines. I had COVID before the vaccines. There was a paper by Chin and colleagues, New England Journal of Medicine, October of 2022, U.S. prison system, 59,000 prisoners, 17,000 staff. Once you had gone through the early phases of the pandemic, the next episode of COVID, 0 mortality. Didn't matter if you took a vaccine or not. So natural immunity for sure carried tremendous benefit. Sure, you could get COVID a second time with Omicron. No risk of death. Very important. So early treatment reduced death. Natural immunity reduced death. And then lastly, the virus mutated to become far more mild. And everyone, all the experts agree on that. Did Anthony Fauci mention those 3 factors on Capitol Hill? No. Did anybody even ask him about those factors? No. You can see the oblivion here, the lack of understanding, the lack of ability to synthesize what's going on. Was there an opportunity for vaccines to have an impact? In the randomized trials, they did reduce the binary chance in the early studies of getting mild COVID-19 at home, not hospitalization and death, and both Pfizer, Moderna, and Janssen and Novavax showed that. They showed that. However, it was based on receiving the 2 doses of the vaccine in the first month and 2 months of observation. No one could have known at month 4 what was going to happen. Yet the Canadian authorities and the American authorities said, take the vaccine. They told doctors and nurses, take the vaccine. It's safe and effective. No one knew at month 4 what was going to happen. How could they possibly have known? They accepted it as an article of faith. Faith, it's vaccine ideology. That's what caused people. Why did the media grasp this so quickly? It was an article of faith. They were hoping the vaccine was going to work. And I don't fault anybody for taking a vaccine because they hoped it was going to work. But the hard realities is it didn't. The consent form to this day says, past tense, the COVID vaccines reduce the risk of COVID, period. The consent form claims no benefit with reduction in hospitalization and death. Yet, Fauci and even Brad Wenstrup, who chairs the committee, they start out all of their statements, now the vaccines save millions of lives. Well, Dennis Rancourt in Montreal, an epidemiologist, has analyzed the vaccines have cost lives. The net is probably increase in death. He estimates 17 million worldwide. There's a paper from the Netherlands recently, just through 2022, in 42 countries, of the 200 countries in the world, in 42 countries, the vaccines cost about 3 million lives. What we have is we have a situation, it's a catastrophe. When people die of a medicinal product being administered, it's a catastrophe. We have a culture of safety. 5, 10, 15, 50 deaths, that's it. It's off the market. Sorry, doesn't matter what the hope is. It's off the market. Pfizer knew about 1,223 deaths within 90 days of their vaccine. They concealed it. The FDA helped them conceal that. Now Pfizer's being sued in 4 states for deception. Should have been off the market. Next slide. Fear and hubris. fear. Everything we received, and we heard great comments about this morning, fearful messages, but yet the hubris. Remember Anthony Fauci saying, getting to the point where he is science. He is science, the demagoguery. We saw hubris. We still see hubris. Next slide. Bird flu. Bird flu. We see it now again. So we had COVID-19, we had monkeypox, and now bird flu. Our research suggests that bird flu is actually a product of gain-of-function research. Now we're ahead of it. This is a paper under peer review coming out of the U.S. Southeast Poultry Research Laboratory. Bird flu. But with monkeypox, we had effective therapy. It wasn't presented to the public. It was about getting a monkeypox vaccine. Next slide. Now we're hearing, take a bird flu vaccine. Take a bird flu. The EU Commission just bought 40 million human doses of bird flu. The reason why mass vaccination should never be done in a widely prevalent pandemic. Now, bird flu is a widely prevalent pandemic for the animals, not yet in humans, but it's anticipated it may be the case. The reason why we should never vaccinate broadly into a highly prevalent pandemic is that the virus will mutate to become resistant to the vaccine immunity. It's a never event. Never do this. Vaccination is not the answer to pandemics. It's following reasonable measures like the Great Barrington Declaration, protecting the high-risk individuals, and then early treatment. If there's ever a role for vaccination, it's going to be in the highest risk category. Limited, because we don't want to foster resistance and we don't want to prolong the pandemic, and that's what COVID vaccination did. Next slide. What's the path forward? Many are concerned they've taken the vaccine, their loved one has taken the vaccine. The answer is we don't know. The Biden administration has spent $1 billion on long COVID, the persistent symptoms after COVID-19, has not acknowledged the vaccine has been taken by a huge proportion of those who have long COVID, and the vaccine is contributing to the syndrome. Paper by Dexner in Germany shows about 70% of long COVID is probably driven through vaccination. They have not even recognized that the spike protein is making people sick. There's manuscripts published where there's no mention of the spike protein. Just that, well, people are sick, we should do something. Next slide. We have proposed through our scholarship that something should be done, and shown in the lower right that at least 3 natural products have a hope of helping individuals, nattokinase, bromelain, and curcumin. At least we can give that a try. We've been doing it now for over a year in our clinical practice. I know doctors across the UK are broadly doing it. Nattokinase and bromelain are natural enzymatic substances available as capsules that do break down the spike protein, for sure, in preclinical studies. Curcumin reduces inflammation from the spike protein, for sure, in human clinical trials, randomized trials. So why not, with a reasonable safety profile, the safety concerns are bleeding or potentially allergic reactions, why not give this a try in the population? We would love large, prospective, double-blind, randomized, placebo-controlled trials. Governments have not even considered this. I can tell you, we have 2 peer-reviewed publications on this as the science advances, and when they were posted on social media, they were instantly censored. Instantly censored. And people said, well, that doesn't work. Wait a minute, how did they know it doesn't work? It hasn't been tried yet. That's the mentality, this instant censorship of any hope to the population. Any hope. And when I testified in the U.S. Senate, I'll never forget, I was the lead witness, November 19th, 2020. The majority chairman was Senator Ron Johnson. The minority was Gary Peters from Michigan. Ron Johnson, no mask, glimmering with hope, bringing the message that we can treat COVID-19. Gary Peters wearing a black mask, talking in muffled tones, made a Freudian slip. He said, what you're about to hear from these witnesses is misinformation. He hadn't heard a word out of my mouth yet. He goes, and I don't want this to give Americans any hope. That's what he said. He meant to say false hope. The point is, it's in the minds of people to take away hope from others. It's in the minds of some people to take away compassion, to take away human interaction. It's in the minds of people, whether it's out of some misguided response to the crisis or whether or not it's truly evil. It's happening, and we felt it, and that's the reason why we're here today. Next slide. Many have extended their concerns broadly to the childhood vaccination schedule, which in my view needs critical review. Okay. The World Council for Health, the World Council for Health, which is an international body led by Dr. Tess Lowry, who was the lead consultant to the World Health Organization, has started her own organization and essentially has said, in her group, which is a consensus document, has said the COVID vaccines being administered every 6 months down to a 6-month-old child was the straw that broke the vaccine's camel back. That's it. It's too much for the children. We need a critical review. It is now the time to consider it safely waiting and seeing how the science and the safety plays out. None of these vaccines have ever been proven to be safe when given in combinations. Very important, and that's how they're given to children. So I want to finish and conclude by stating we're at some type of threshold. We're in a great controversy in medicine. The medical orthodoxy has been wrong multiple times throughout history, and they remain wrong for years before they correct their position. I'm not in the orthodoxy on this one. But the medical orthodoxy was wrong on hand washing. When Dr. Ignaz Semmelweis proposed it, for 20 years, doctors refused to wash their hands and spread infections to pregnant women. The doctors were wrong on smoking when Rosenhill proposed that smoking causes lung cancer. The doctors and nurses denied it for decades until the U.S. Surgeon General report came out. The doctors were wrong on the opioid pandemic, which turned out to be a disaster, and we were years behind on this, and they are wrong on COVID-19 vaccination. So your charge is to go out, speak to others on this in a reasonable, dispassionate, level-headed, empathetic way. Talk to your doctors about this and say, I am concerned about vaccine safety and what we've seen, and you're going to hear a lot more about it today, and let the doctors and nurses and others know your concerns. If they hear concerns voiced over and over and over again, it will start to sink in, and you will change the course of medical history. I'm Dr. Peter McCullough. Thank you so much for joining us today. Great crowd. All right. Unify Canada. Yes. Thank you so much.